My name is Jennifer Funke. This is the clinic that I work in Poplar Bluff, and I'm going to do a demonstration of upper extremity joint mobilizations. Please excuse my voice and my occasional cough. I've had bronchitis this week. Thanks. And a patient who was in a motor vehicle accident. He's 2 days out of being in the long arm cast and has shoulder restrictions, elbow restrictions, and wrist restrictions. I'm going to start at the elbow. The first joint mobilization I'm going to do is an inferior glide to the glenohumeral joint to increase abduction and flexion. He's not having much pain at the shoulder, so I can do grade 3s and 4s at the shoulder to help increase range of motion. He's only able to get it up to about 90 degrees right now. So he's in a semi-open pack position right now. I'm going to grasp his arm and take him up to about 90 degrees, which is his point of restriction. And then I'm going to do an inferior glide. I would have already assessed his range of motion at the beginning range, through range, and end range. I'm going to go right into a grade 3, large amplitude towards the end of range. And then I would reassess his motion. The second joint mobilization I'm going to do is an AP glide of the glenohumeral joint in abduction in order to stretch the posterior capsule and to help increase range of motion. This is especially good for increasing internal rotation. Again, I'm going to do a grade 3, or you could also do a grade 4. So I'm going to take him up to the point of restriction, which for him is about 90 degrees again. And then I'm going to do grade 3s, AP, large amplitude towards the end of range, into the restriction. The third mobilization at the shoulder I'm going to do is a PA glide of the glenohumeral joint in abduction. Maitland notes that grades 2 and 3s or PA glides are useful at any stage of adhesive capsulitis to mobilize and stretch the anterior and posterior capsule. And we don't know that this patient has a frozen shoulder, but he's certainly at risk for one after being in that long arm cast and not being able to lift his arm. So I'm going to stick with grade 2 PA glides to help mobilize and stretch the capsule. So before there's the end of range restriction, large amplitude. And then for my fourth joint mobilization at the shoulder, I'm going to do scapulothoracic mobilization. So I'm going to have my patient roll to this side, please. I'm going to place a pillow between me and him for comfort. Slip my arm under here so I can grab the scapula. Hold onto the inferior border here and put my hand up here so that I'm kind of using my hands. I'm going to go cephalocaudal, mostly because we want the scapula to move more for full shoulder motion to be available. And if he wasn't able to lift his shoulder with a cast on, he's probably having trouble moving the scapula properly. For this purpose, I'm going to transition between grades 3 and 4. So just kind of assessing his motion. And then as he gets down, and then some grade 4s, some grade 3s, grade 4. Okay. Next, I'm going to move on to the elbow. His elbow is more painful for him than it is stiff. So because of that, I'm going to stick to grades 1 and 2 mobilizations. He only has about 15 degrees of flexion around the 90-degree point at the elbow. My subject has quite a bit more of that, so I'm going to work with what he has instead, just knowing that I would have to change things up a little bit for the patient in the study. The first thing we can do is just a little bit of joint modulation with distraction to decrease pain. We're going to stick to grades 1. I would want to decrease his pain, do a lot of grade 1 and 2 mobilizations before I would even attempt to work on grades 3 and 4 for increased range of motion at the elbow. So just slight distraction and just very gentle, almost not moving for grades 1. Also, we can do an anterior glide of the radius to help increase supination. Grades 1 and 2 will help decrease pain with this motion. I'm going to stick to grade 1. So I'm going to feel for the head of the radius. And my patient in the study can only move maybe about this much. So a grade 1, just grasping the head of the radius and just barely going into it for pain modulation. And then at the elbow, I think I'd probably stick to maybe some grade 2 passive elbow flexion, just because he is having so much pain. So I'm going to stop before he would get to his restriction. And for this patient, large amplitude, stop before the restriction, so we're sticking to grade 2s. Okay, and then we would move on to the wrist because he's also having some restrictions at the wrist. He has 15 degrees of wrist flexion and extension, more stiffness than pain, so I can do grades 3s and 4s at the wrist. For the purpose of this, I'm going to show you grades 4 for the first 2. To help increase extension, we're going to do an anterior glide at the radiocarpal joint. So he may be, my patient in the scenario may be stuck more in this this way because of the long arm cast. He may not be able to supinate and pronate much. And I'm going to hold on here and then find the restriction and then do short amplitude mobilizations into the restriction anteriorly. To help increase flexion, we can go for PA glide. And we could do this in sitting as well. He seems to be pretty comfortable laying down, so I'm going to leave him there. So again, find the restriction, short amplitude into the restriction to help increase the flexion. We can also do a wrist supination mobilization, transition between grades 3 and 4 to increase the range of motion. Again, this could be done in either supine or sitting. So knowing that the actual in the scenario given to us, he probably would not be able to supinate this much. But for this purpose, grade 3 would go into the restriction, large amplitude, and then a grade 4 would find the very end of the restriction and smaller amplitudes. More grade 3s. And grade 4s. Do you feel great?
Yes.